Hi, my name's Manoj, Krishna. I'm a spine surgeon, and today I want to present one of my most challenging cases. Amanda is 34 years old and had had 5 previous decompression or discectomy operations before I saw her. She'd had the pain for more than 15 years. Her MRI scan showed that the 2 bottom discs were quite worn, as you can see on this MRI scan. And at the L4-5 level, there was a disc bulge posteriorly. She was severely disabled by her pain, and on the cross section you can see how the disc is bulging on the right side. This was at the L4-5 level. At the level below that, at L5S1, there was a disc bulge on the opposite side, on the left side. Amanda had tried and failed all the conservative options, and we told nothing can be done. We treated Amanda with a posterior lumbar interbody fusion at L4-5, taking the discs out, putting cages filled with bone into the disc space, and then putting screws and rods at the back of the spine. We also put a spacer at the L3-4 level. Amanda took about 6 months to recover from surgery, and then she got some pain in the sacroiliac joint, which we treated with a small injection into the sacroiliac joint. Here's Amanda telling a story. Evening, Amanda.
Good evening.
So, how old are you, honey?
I'm 34. I'm going to be 35 in 3 weeks' time.
3 weeks' time, okay. You're a year from surgery.
Yes.
So, and we're recording this so that other people can learn from, your experience. So, tell me a story about your back pain, when it started, please.
It started when I was about 19 and I was chambermaiding in the summer holidays, and with making beds and turning mattresses, I just felt my back go. Thought I just pulled a muscle, and saw the GP, who pretty much thought the same, gave me some painkillers, said it would go in a couple of weeks. And then over the weeks and months it just didn't get any better. It got steadily worse. GP gave me more pills, stronger pills, even sent me for an x-ray, and because the x-ray showed no broken bones, they thought it was just pulled muscle and that it would get better.
Okay.
But it didn't. It got worse to the point where I couldn't move, couldn't bend, couldn't get dressed, couldn't get out of bed. Really, really bad.
And then what happened after that?
And then after about a year of feeling like I was knocking my head against a brick wall, I saw a consultant up in Newcastle who said that he was going to refer me for an MRI scan, and had the MRI scan, and he said, clearly obvious, you have a prolapsed disc and need surgery. So I went in and had discectomy.
Okay.
And so I had that, and everything seemed okay.
That was about 18 years ago then?
Yeah.
Okay.
Yeah. So I had the operation, everything was fine, and then...
Did you get better?
The pain went after the operation.
It was in your leg, wasn't it?
Yeah. And after I came round from the operation, yes, for the first couple of weeks, the pain had all disappeared. And then as I started to do more and more, it started to creep back into my leg again, and my foot was going numb, and straight back in to have another MRI scan, and they found that the same thing had happened again at the same level, and I needed the same operation again.
Okay.
So I had that done 6 months later, and then...
Did you recover? Did you improve after the second operation?
Yeah, I did feel better after the second operation, and I suppose I did recover, and but I always had pain on and off, and throughout my 20s, I think I was in and out of hospital so many times with my back seizing up or not having feeling in my legs, and they just said there was nothing we can do. You know,
Okay.
it's just, you just have this weakness or this problem in your back, and there's nothing we can do.
And you were taking lots of painkillers at this stage?
Yeah, and I think towards when I was about 30, the pain started getting really, really bad. And I was having tests and scans, and whilst all this was going on, they just gave me morphine and more morphine, and I think I must have been on such high dosages of morphine for over a year, just while they were trying to figure out what to do.
So this was 2 previous operations, then
Yeah.
10 years of quite severe or longer throughout your 20s. And then what happened after that?
Then I think they found that I had another prolapse disc on the lower level. So I had my 3rd operation, and then about a year after that,
Were you better after your 3rd operation?
again, I was better for the first 4 or 5 months.
Okay.
I felt better, the sciatic pain had gone, and then again it started to creep back again, and I would end up with it worse. So I had my 3rd operation, then the year after that I had 4th one,
Same thing, discectomy.
discectomy,
decompression,
yeah, and then year after that another one. So
5
I
operations.
had 5, yeah, 5,
Early. Okay.
5.
And by this time, I think after the 5th operation, when you weren't that much better, you're really quite disabled.
Yeah, disabled, disheartened, totally fed up with everything, really. Just couldn't seem to hold down a job. My university life had been disrupted, had to keep taking years out because of numerous operations and what have you. So yeah, just really, really fed up.
And then you saw me, you met me purely by accident.
Yeah, my mum saw an article in the back of the Yorkshire Post, I think, about one of the people that you've saved, and talked me into coming to one of your coffee morning meetings, which I did not want to go to because I'd had enough of doctors. But she talked me around, and we came and we saw, or we listened to all the stories that your patients were talking about their previous symptoms, and I just identified with it, with them straight away, and thought, well, if he can fix them, maybe he could fix me.
So when I first saw you, which is more than a year ago now, let's see how disabled you were. So how long could you sit, stand and walk for example?
Walking wasn't too bad. Sitting, I would get numb, I'd get pain in the bottom of my back, and then if I was to do any sort of exercise, I would end up with a dead leg, and then just pain in my back. I can't actually remember a time when I was pain-free.
Okay, and then you were on a lot of painkillers. So what were you? Do you remember what you were taking at the time?
I was taking I think there was cocodamol, gabapentin, diclofenac, tramadol. Then there was the morphine. I seem to have been on morphine for about on and off, maybe 2 or 3 years.
How many tablets in total? Do you remember?
Oh goodness!
In a day.
I probably took about 6 or 7, 3 times a day. I probably rattled if you'd shaken me.
I think it's more than that, but anyway, okay. So we identified the 2 discs that you'd had previous surgery on. You had a PLIF, a posterior lumbar interbody fusion, about a year ago. And was it quite daunting to think of a 6th operation?
Yeah. Part of me thought, oh no, not another operation. But then the other part of me thought, well, if it's going to work, then this could change my life. And then you uttered those magic words of "I can fix you," and it was just wow. Let's just do it. Though, yeah, obviously this huge operation, I was pretty scared.
I was a bit reticent too, because you'd had 5 previous operations and quite cautious. But I think in the end we both decided to get on with it. So it was about a year ago. So talk me through the operation, and then let's talk about your recovery after that.
The operation itself was fine. I was up and about, I think, 24 hours later, walking around. Yeah, I mean, you had the general post-surgery aches and pains, but I remember when I first came out of surgery, the pain was quite horrific. It was just really, really bad. But then 24 hours later, it had subsided, and I was able to, move around.
Okay. So you went home a couple of days later?
Yeah,
maybe?
yeah.
Okay. And then what about when you got home, recovery-wise? How long did it take you to walk a mile, start driving, things like that?
It probably took a couple of weeks, I think. And then I think once I did my first mile, then I was able to do the second one and the third one. And but I think initially you're always a little bit cautious about, have I gone too far? Am I going to push myself too far? And especially because of my history, I was so scared about doing any damage. And I just remember you saying to me, well, you're all bolted in, you can, you're fine. So the recovery was definitely slow.
It's slower than normal because of your previous operations.
And obviously getting off all the medication, especially the morphine, was very difficult. It did take me longer. But
how long do you think it took you to? When did you start feeling that the pre-operative pain had gone?
Probably, I would say maybe, maybe 4 months, because I got a lot of, although the pain in my back had disappeared, I got nerve pain down my right leg and in my foot, which was quite, and I'd never had that sort of nerve pain before. It was like a burning sensation. And that, I think, was quite bad. So it was probably about 4 months when I felt, I got up in the morning and thought, there's nothing there.
Okay. And then you had some sacroiliac pain. We did some injections.
Yeah.
So you're a year from surgery now.
Yeah.
So talk me through how you're doing.
I am. I'm really, really good. I can do exercise. I can clean the house. I can hoover. I can do all the things that I never really could before. I can walk in high-heeled shoes. Just get on with normal life. And I do get back pain when it's that time of the month, but it's like there for 4 days and then it just disappears.
Okay. How much pain do you have otherwise?
Hardly any.
Any painkillers?
The odd paracetamol, I suppose, but that's about it.
And sitting comfortable?
Yeah, for hours, can watch full film, go to the theatre and not have to worry, sit on a long train journey and not have to worry.
And I think you felt it took you a while to get mentally better too, because this pain had really messed with your head for so long.
Yeah, definitely. Just the whole of the 10, 12 years had such an effect, and I think suddenly when I was fixed and I had no back pain, it was no longer Amanda and her back, it was just Amanda, and that took me a while to get my head round and figure out who I was without the pain, because I can't remember the last, that was when I was 18 when I was last like that. So
it's almost you must have no memory of being pain-free because it's so long ago.
Yeah, no, I can't remember what it was like. So it's a new life.
I mean, to me also, it's remarkable, that we have a young person who's had pain for almost 20 years and 5 previous operations,
Yeah.
and we do this interbody fusion, and you say you're like virtually pain-free. Even for me, that's a bit, you know,
You give people back their lives.
it's amazing even for me. But thank you very much
Thank you.
for sharing this. Thank you.
Thank you.